Canada has no immunity to this. And as the pandemic persists, those opposing masks seem to get a bit louder, a bit more aggressive, and certainly statistically a bit more partisan. But the picture is still that Canada is a place where faith in public health is high and mask wearing is the norm. It was in the summer, at least for some 83% of Canadians. Not so for our neighbors to the south, where the summer occasional mask wearing was the norm for just 68%.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary, you don't have to do it. I don't think I'm going to be doing it.
Please wear your masks.
And when he didn't, they didn't. Listen to the crowd booing at a New Hampshire rally after being told public health rules dictate they put on masks. To observe American political rallies from afar is to presume the act of wearing a mask is akin to declaring who you're voting for. And that's a surprise to those who thought they had a handle on how the world might respond to a pandemic.
Infected people got a respiratory illness with symptoms ranging
Scientists at Johns Hopkins ran a simulation on a fictional coronavirus last fall, before COVID came calling. They envisioned deaths of the vulnerable, pain for service industries and airlines, almost everything we've all encountered. Dr. Eric Toner led the simulation.
Did you anticipate or build in the idea that public health measures would be deemed political?
No. I think we did not anticipate that. Yeah, I would have thought they would be off base.
It is so tempting to see what's happening now as a uniquely 2020 thing. Think of it. A president sick with a virus that's killing hundreds of thousands of people, his doctors evasive on the facts of his case, his administration downplaying health measures while an anti-mask movement is underway. But all of those things have happened before, more than a century ago, when this man, Woodrow Wilson, was the president who got that feared virus. To know that history has repeated so precisely is jarring.
Everything old is new again. There was an anti-mask uprising in 1990 during the so-called Spanish flu, and the reasons they were voicing then were the same as the reasons now. They said, well, they didn't think masks worked and they thought it was a violation of their civil liberties.
Then, as masks became mandatory in the worst-hit places in the US and parts of Canada, anti-mask protests emerged. A detail that initially astonished Canadian researcher Stephen Taylor, who wrote about the psychology of pandemics last year. He sees a lot of parallels.
We've seen the rise of racism, the anticipatory anxiety, the stockpiling, the anti-vax attitudes, fake news, conspiracy theories, rumors, all of those things have been seen before.
So why the need to enforce masks then and now? Why the hesitation to wear them? Taylor thinks the psychological drivers may not have changed much in 100 years. Not just those who think the virus won't affect them, but those who take it further.
There's a group which we're calling a kind of a COVID disregard syndrome. When someone tries to encroach upon their freedoms, they react in almost a very strong pushback. And the people who have this reactance tend to be anti-maskers, they're anti-vax, and they want to open up the economy. They don't want to engage in social distancing. They also tend to be politically conservative as well.
This is consistent with the makeup of anti-masker crowds in places like Quebec. Those rallies often peppered with signs promoting anti-vaccine messaging and conspiracy theories. But it seems there's more to anti-masker protests than that. Confusing signals from leaders can do real damage to public confidence.
Early on, we were told by the WHO, by health authorities, do not wear a mask, you do not need to wear a mask, save the masks for the healthcare workers. And we got that message for many months, and then suddenly there was a complete 180-degree shift, and we're told we have to wear masks. So that mistake in messaging can sow the seeds of confusion for many people.
So how do you course correct, especially when vaccines become available and doubts rise anew? Again, look back. The mask rebellion of 1919 ultimately fizzled out, not just because there was no social media to spread it, but because an overwhelming number of people became sick. It was personal. Public health campaigns became louder, more insistent. Keep that up, is the advice.
So in your scenario, how did you overcome misinformation from governments and public distrust?
Well, what the participants said, and they used an American football analogy, which is you need to flood the zone. You need to have everybody, public health authorities, elected officials, everybody just flooding the airwaves with the accurate information.
Mocking and shaming aren't advised. It may only make people dig in. But some countries feel they have few options. In Indonesia, those who refuse to wear masks are being ordered to dig graves for COVID patients. Sometimes get in the graves and just lie there for a while. An Italian legislator was physically removed by colleagues for refusing to wear a mask. In India, you cannot make a phone call without hearing a recorded voice urging mask wearing. The voice actor, now a bit of a star.
The voice of this message has become a little irritating.
Definitely annoying, but the message sticks. As carefully as statisticians collect COVID case numbers, pollsters gauge attitudes, especially in the US. And for the briefest of moments a few weeks ago, they saw a flash of togetherness. An increase in Democrats and Republicans claiming to take the virus seriously and to consider more mask use. That happened when the president was diagnosed and all those masks started showing up at the White House. Modeling matters. But that was then. 4 more years! 4 more years! The president has since recovered, and as the gloves come off in the election run-up, so do his masks. And the worry is, so do theirs.